Hi, I'm Ruchita. A lot of you know me already. Welcome to our session and thank you for being here today. I'll quickly start by introducing myself. I'm Ruchita Dhiman. I'm a special needs mom, and I have two children who've actually done stem cell therapy from NeuroGen. And a few of the parents actually reached out to me saying that they wanted to know a little bit more about stem cell, and we are very, very privileged today to actually have Dr. Alok Sharma talk to us about stem cell therapy and, of course, integrated therapy. So a little bit quick introduction to Dr. Alok Sharma before I pass it on to him. But also before I pass it on to him, I'll very quickly take you through what the agenda is. So I can see that there are a few of us who've joined in today, mostly parents, I can see. So it's a 90-minute session. Dr. Alok Sharma will be talking to us about integrated therapy shortly. We also have invited a few parents to talk to us about their experience, their personal experience, because many parents always reach out to me and they want to talk to other parents. So we have a great privilege to also talk to a few experienced parents. And plus, at the end, it'll be an open forum, so you can ask your questions too. So there you go. That's how the day is going to be. That's how our session's going to be laid out. So now let me start by inviting Dr. Alok Sharma to the session. And a little bit about him, you can see him already. You can see that, we can all see him. So Dr. Alok Sharma is the director and consultant neurosurgeon of NeuroGen. He's also a renowned and respected neurosurgeon, neuroscientist, and a professor across the world. So he's very renowned for his work in medicine with extensive surgical expertise and experience in areas of neurosurgery, neuroscience, and stem cells. And with that, Dr. Alok Sharma, I'd like to invite you to say hello to us and start your presentation, please.
So at the outset, I'd like to thank Ruchita for all the efforts she has made into making this webinar happen. Thank you so much for your efforts. I hope that whatever thoughts I share today will make a difference to all the participants. So I'm Dr. Alok Sharma. I'm a neurosurgeon, director of the NeuroGen Brain and Spine Institute and the KLS Wellness Center of Anti-Aging. I am also retired professor and head of the Department of Neurosurgery at the LTMG Hospital. So the reason we all here is because we have special needs children and that we've gone from pillar to post, we've gone to doctors and therapists, and everybody's told us just one thing, that nothing can be done for your children. And then you have done what all parents do. You've researched, you Google, you've tried various therapies, you've made everything that you can possibly do happen. And then, of course, you pray. But today, I'm here to let you know that your prayers have been answered and that science, technology, modern medicine has finally come up with a solution to the problems of our children. So, the first thing I'd like to share with you is newer brain imaging. So, this is a scan that is referred to as a PET CT scan. What you see here in blue is a part of the brain that is damaged, part of the brain that is inactive, part of the brain that's not working normally. And we've done this scan in more than 4,500 children with autism. And every child with autism has this or something similar to this type of damage. When the scan is done in normal children or neurotypical children, none of the children have this kind of damage. So this is just a technical slide. All the areas, these are areas of the brain, amygdala, hippocampus, parahippocampal gyrus, cerebellum, etc. We have found that these parts of the brain are working less. But what we've also found is that there are parts of the brain that are working more. So today, there is a complete new approach and outlook to children with autism. we have to stop looking at what they don't have, and we have to look at what is special, unique, and different in them. Uh, we're all aware that Elon Musk, one of the richest men today, had autism. And that is because his brain had these parts functioning more than others. Albert Einstein, the world's greatest scientist, also was known to have autism. And so did many distinguished people. So now the entire shift is focused on from what they're talking to you about. It is published in a scientific paper. And now our paper and research showed us something interesting. It showed that the brain functioning or brain metabolism decreases with age. So you can see the figures below. There is 2, 4, 6, 8 other ages. And as you can see that line over the year, the brain metabolism decreases in these children. And I will share with you why this is important. So here again in the dark blue, this is the brain metabolism of children with autism, and you can see with age it keeps on decreasing. In the light green is the brain development of neurotypical or normal children, and you can see with age it keeps on increasing. Now, why is this important? This is important because if the earlier you treat, let's say you treat at 5, you'll see that there is a very little gap between the brain of an child with autism and a neurotypical child. So you have to bridge a smaller gap. Whereas if you treat a child at 15, you will see that the gap is bigger. And so you have to put in more effort and it is more difficult to get results. So this is the fundamental of early intervention. That the earlier you treat, the better results you get. So then there is also newer biochemical research. What we have found in the recent few years is that these children with autism have lower vitamin D levels. They have decreased oxytocin hormone. They have antibodies to what is called folate, which is one of the vitamin B complex. We have elevated homocysteine levels. It's just it's distracting me. Shut that, please. That noise is distracting me. Okay, there are elevated homocysteine levels and there are elevated B12 levels in mothers. Now, all this research is very important because these are simple to correct things. For example, vitamin D levels can be normalized just by exposure to the sun. 30 minutes to 1 hour exposure to the sun elevates vitamin D levels, or we may have to give supplements. The same is true of folate autoantibodies. We may have to give vitamin B12 in a different way. So there is new science developing all the time. Now, what is new about the approach is that earlier it was believed that the nervous system cannot regenerate. But now we believe that the nervous system can be regenerated by cellular replacement and repair. So this was the thinking that there is no regeneration possible for over 150 years. This is the present thinking. So the management of autism over the last 2 to 3 decades has become multidisciplinary. So, we now have, in many diseases, there is a single treatment that can solve the problem. But in autism, it is going to be multidisciplinary. For example, we will need speech therapy, we need ABA, we will need occupational therapy, things like hyperbaric oxygen, all these biomedical treatments, all these help. Cell therapy is a new addition to this. But along with cell therapy, we will need all these other treatments as well. So the first thing to remember about autism is there is no one single silver bullet. We will have to make it multidisciplinary. So if you look at this, you can see this is a fracture in the leg bones. These are the two bones in the leg, and you can see this broken bone. And I ask all of you, if you had a fracture of the leg, would you do physiotherapy or rehabilitation or exercises on a broken bone? You would not, right? What you would do is you would fix it with plates and screws and then do rehab. But in our children on the spectrum, we do the exact opposite. Here's a scan of a child with autism, and you can see that there is brain damage, and we are doing rehabilitation on this brain, damaged brain. Obviously, we will not get the results that we expect because we are doing damage on, we are trying to repair the, we are trying to do rehabilitation on a damaged brain. Now, what if we could regenerate or repair the brain and do rehabilitation on that? Would or would we not get better results? And the good news is that this repair and regeneration is possible, and we'll show you how it can be done. So, a little bit about autism. The incidence of autism is literally going through the roof. Now, look at this. In 2004, the incidence of autism was 1 in 166 children, according to the US CDC, which has the most accurate figures in the world. And today, the incidence of autism has become 1 in 36. So you can see and if you see year by year, 1 in 66 in 2004, then 1 in 50, 1 in 25, 1 in 110, 1 in 88, 1 in 66, 1 in 59, 44. Now, if you look at this graph, if you imagine what will happen in a couple of years at this rate, in the next year, this will become 1 in 25, then maybe 1 in 15, then maybe 1 in 5. And then what? So these are figures from the US CDC website. They are the most accurate. And this shows something that the world has not recognized, the massive increase in the incidence of autism. Based on this, it means that there are 70 million people on the spectrum, which is 1% of the world's population. So, what exactly is autism? It's a neurodevelopmental disorder, typically appears during the first 3 years of life. We call it mild, moderate, or severe spectrum disorder, and boys have it 4 times more than girls. The problems are that of communication, social interaction, and repetitive behavior. Now, what we have to understand is if the brain is like a computer's got hardware and a computer's got software. So, you have to understand that the repair of both is different. Whereas cell therapy or stem cells that we talk about will repair the hardware, rehabilitation and teaching at homes will repair the software. Therefore, both are important. I wish to emphasize that cell or stem cell therapy only fixes the hardware. We will still need software. So these are the different kinds of therapies. You can see that is speech therapy, occupational therapy, special education, sensory integration, speech therapy, and physiotherapy as well. So all these therapies, I won't talk in this talk. I will not go into different types of rehab because most of you are familiar. But all these are important. I wish to emphasize that all of these are very, very important. So now we'll come to the main topic, which is cell therapy. So what exactly are stem cells? So just like the stem of a tree can give rise to branches, leaves, fruits, etc., there are some cells from which different cells of the body can arise. These cells are called stem cells. So a cell which can become a nerve cell or a blood cell or a brain cell or a muscle cell, that cell is called a stem cell. So basically, what exactly is cell therapy? What we do is we take healthy cells to replace the damaged cells. So if this is the damage, in the brains of children with autism, when we give cell therapy, the damage goes away. Now, I just like to show this to show, it's an interesting slide. Like 20 years ago, 25 years ago, if you had to shoot a video film, you needed a video camera. If you wanted to take a still picture, you need a camera like this. If you want to type something, you needed a computer. To listen to music, you needed a music player. Calendars were separate. If you had to make a phone call, you needed a landline. For a calculator, you needed something like this. To watch television, you needed a television screen. For a torch, you needed a torch, compass, map, etc. But today, all of this has come into the palm of our hands in a single device. And just like all these things have come in a single device, in the same way, different actions for which you require different medicines, drugs, and surgery have all come together in the stem cells. Whether it is modifying the immune system, whether it's reducing the inflammation, whether it is improving the neural cells, propagation, whether it's reducing cellular death, releasing growth factors, myelination, multiplication and division. So all these things, which earlier were required different medicines, all of this has come together in a single action of the stem cell. So worldwide, there are several publications. There are more than 290 publications of cellular therapy in neurological disorders. It also works on orthopedic conditions, wound healing, cardiac conditions, COVID, diabetes, etc. In autism, there are over 33 papers. In cerebral palsy, there are 44 papers. In other conditions such as spinal cord injury, head injury, there are all these papers. So this book called The Harrison's Principle of Internal Medicine is like the Bible of or Quran or Bhagavad Gita or of our medical world. So this is the standard textbook that all of us study. And now Harrison's Principle of Internal Medicine has a chapter on regenerative medicine, and it talks of many neurological conditions that can be treated. The most prestigious recognition in the field of medicine is the Nobel Prize. And three times in 15 years, 1990, 2007, 2012, the Nobel Prize has gone to stem cell work. In fact, the work that we do, stem cells from bone marrow, that got the Nobel Prize in 1990. So this is not a completely new science. The science and research has been happening for many years. Today, we are able to implement and bring this technology to our children. So how do these cells work? Their first ability is that they multiply. So if you have a single stem cell, they can become into multiple cells. Then this property is the most important. A stem cell can become a brain cell, a heart cell, a liver cell, a muscle cell. So the same cell can become anything depending on where you put it. They have the ability to improve the blood supply and they release certain positive chemicals. Because of this, they can repair, regenerate, and replace damaged tissue. So you can get cells from the patient itself, from the child itself. These are called autologous, when you take from the child and put it back in the child, or you can take it from a donor, which is from somebody else. There are, of course, different types of cells that you can get. You can also get them from the embryo, which is the unborn fetus or the embryo in the mother's womb. But these are controversial, and so we do not use it. You can get from the umbilical cord in case you have saved the umbilical cord of your child. But what we do is we take out from the bone marrow. We have found that inside the bone, there is a liquid called bone marrow. And when you take bone marrow out, it has got millions of stem cells. And the last type, iPSC, is still in a research stage. So we use adult stem cells. Why do we work with them? Because one, they are safe. They don't form tumors. They don't get rejected. You can get them from a needle. You don't have to do any surgery. And there are no ethical issues. Now, how do you inject these stem cells? You can inject them through the lower back into the fluid in the lower back, and that fluid takes it to the brain. You can inject it as an intravenous injection, as an intramuscular injection. You can give it through the nose, or directly you can put it in the brain. So how do we do it? So we have a simple three-step procedure. The first is we put a needle into the pelvic bone. This is the bone just above the hip bone. See, this is the hip bone. Above is the pelvic bone, and we put a needle through the skin. Here you can see we put a needle into the bone and we aspirate the liquid in the bone called bone marrow. This takes about 15 minutes. This bone marrow we now take to a laboratory where we sort of filter it and separate the stem cells. And then the stem cells, with a very thin injection, we inject it into the lower spinal fluid from where it goes up to the brain. So this is how we do it. You can see this is the stem cells that are bone marrow is being aspirated. We take it to the laboratory. Here it is. And through a single needle, we are able to inject it. So let's just see it again because this is an important video. See here. You can see this is the bone marrow coming out. As the child is asleep, we take the bone marrow to the laboratory. We run it through machines, separate the stem cells. And then once the stem cells are ready, with a very thin needle, we inject it into the child. So worldwide, what is the work done on this? So there are a total of 33 papers which show data from 400 patients, which show 80% of the patients improve. So the world's first published paper was published from India, which was actually published by us. The second paper came from China, the third from Italy, the fourth and fifth from United States. The sixth paper again we published. Then the seventh, eighth, and ninth came from Vietnam, Iran, and the United States. So this is the world's first paper. As you can see, the paper talks about autologous, which means from self, bone marrow mononuclear cell therapy for autism. So this is the world's first paper, and here we showed 91% of our patients showed improvement. The second paper came from China by Dr. Yong et al., and here they showed a 88% success rate. The next paper came from the United States by Dawson, and they showed a 90% success rate. This other paper from Kimberly from the United States also showed a 90% success rate. Martinez from Mexico showed a 95% success rate. And Thang et al. From Vietnam showed a 93% success rate. And Bradstreet from Italy showed a 78% success rate. And this is something called systemic review or meta-analysis. This is a study of many studies. And here was 461 patients, and they showed it is safe, it improves patients, and there was a significant improvement in all the various scores. This is another meta-analysis. This was of 325 patients, and they also said it is safe and that the scores in those who received cell therapy were higher than in the control group. So our own published results are, next paper was in the American Journal of Stem Cells. This is a prestigious journal in 2020. And here we showed, this is 254 patients. Now, if you see here, above are the results and below is what has improved. So social interaction improved in 67% of the patients. Eye contact improved in 80%. Attention concentration 80%. Stereotypical behavior 53%. Aggressiveness 56%. Hyperactivity 67%. Self-injurious behavior 54%. Sitting tolerance 86%. Command following 84%. Speech in 61%. And communication overall in 60. So this is the percentage of improvement as we have documented. And these are various scores. There's an Indian scale for autism. There's a CARS international scale. And even here we showed a 94 and a 95% improvement. Now here is one interesting finding. What we found is that between 0 to 5, we had the best results, almost a 98% success rate. From 5 to 8, it dropped to 95. And then after that, it dropped to around 90. So it means the earlier you treat, the better results you get. And this is the proof of improvement from objective findings. So above, you can see this is the brain damage or the inactive brain before the stem cell therapy. And 6 months after our cellular therapy, you can see that the damage is almost gone, significantly reduced and almost gone. This is at 6 months after the cellular therapy. So we have shown for the first time to the world that the damage in brains of children with autism can be reversed. You can see the difference here. I'm just showing you 1 or 2 slides, but we have over 4,000 such pictures. So this was on what is called a Siemens machine. So it looks a particular way. This is on a General Electric, a G machine. Here again, you can see the damage before, and you can see afterwards this is improving. And we have a total of 16 scientific publications in autism. Now let's, also there is this medical textbook. So medical textbooks are books that doctors read as part of their education. And in this book on recent advances in autism, they published a chapter, Stem Cell Therapy in Autism Spectrum Disorders. But not only they published a chapter on this, but they asked us to write it. So we wrote this chapter. So now we'll just see a couple of videos of patient improvement. The first one is a child from America. This child's father is a cardiologist, mother is a nurse. He was quite severe on the spectrum, but now he's improved so much that earlier he could not go to a normal school. He was in a special school. Now he's going to a normal school. And now this child is totally independent. Recently, his father just called me and told me that he went to Europe all alone, and this boy is able to travel across country, overseas, all alone without his parents. That is the improvement. Let's see his story.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
Webinar, life children.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just...
One person.
So excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So as you can see, his autism is completely reversed. He's normal. His behavior issues have reduced. He is going to a normal school and he's getting A+. So a child who could not go to school at all, to a normal school, who was in a special school, is topping today in a normal school. The second video is of a mother who didn't have to bring up one, but 3 children with autism. This is a mother from Nairobi, Kenya. She first had 4 daughters. 4 daughters. In her 5th pregnancy, she has triplets, and all these 3 triplets have very severe autism. Her life was very difficult for her. In fact, there was a time that she actually didn't thought she attempted suicide a couple of times because she couldn't handle it. And then we treated the children, of which one is now completely normal, and the other 2 are very close to normal.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
And the last video I'd like to show you is this child from India. He's one of the earliest patients we treated. The reason why I want to show this video is because here's a child who could not speak himself, was a special needs child, and today he's improved so much that he now looks after, he teaches special needs children. Let's see his story.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered why did this happen only to me.
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on the feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes.
Stop it. Look at him. What do you do? Come back. Okay. Don't do that, no?
It's been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
Very important, he passed his 10th grade of school.
There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
Tuitions of deaf children. These are deaf children. And today Shantanu takes tuitions of deaf children. So these are the kind of improvements that are possible. Now we'll quickly look at cerebral palsy. In cerebral palsy, there is damage to the brain, but there is more problem in the body than in the mind. So there are different types of cerebral palsy. One half can be affected, or just the legs can be affected, or the whole body can be affected. And there are different names that we give to different types of cerebral palsy. So here you can see the scan. Now, if you remember the autism scan, the damage was more light blue. Here you can see it's a dark blue. So the damage is much more severe in children with cerebral palsy. There are some medicines that are available to for the spasticity, for the epilepsy. There are some surgical options, but there is nothing that repairs the damage. But with cellular therapy, we have shown, you can see here, this is the damage before, and you can see that afterwards, the damage has improved. So even the severe damage of cerebral palsy can be improved with cell therapy. And this is a scientific paper where we have documented our results. We have a total of 15 scientific papers. And here's a video of a child from Nairobi, Kenya, who was very severe spasticity, was totally wheelchair bound. He could not use his hands and legs. And we will see his improvements. Also, we have this chapter in this European textbook, Cerebral Palsy Challenges for the Future. There is a chapter, Stem Cell Therapy for Cerebral Palsy, and we have authored this. So this is the child totally wheelchair bound. And you can see after the procedure now, you can see he's able to stand, which was not possible before. He's able to use his hands and remove his own clothes. He's able to pack a bag with both hands. He has improved motor activities. He's able to stand up, take out a bottle of water and open it. For the mother, this was such a big thing that a child who was totally wheelchair bound is able to actually on his own. And there you can see he is now walking by himself. So we have got many patients of cerebral palsy out of their wheelchairs. Then the last thing is intellectual disability. Earlier, this was referred to as mental retardation, but that's a word we don't use anymore. And again, the world's first scientific paper on this has come from us. Now, here in our study, we had 58 patients, 29 of which got cell therapy and
I'm so
rehab,
sorry, sir. I'm going
and
to
half of
interrupt
them got only rehab, and you can see the difference. So
Excuse
those who
me.
got only rehab, the results are in orange. In cognition, 17% improved. But those who got cell therapy and rehab, 55% improved. The memory improved at only 12% with rehab, but with cell therapy, 88%. Problem solving improved 24% with rehab, with cell therapy and rehab, 50%. So, like that, you can see the difference. Understanding of relationships from 26% improved to 68% in the cell therapy group. Social inhibitions, 19% with only rehab improved, 72% with cell therapy and rehab. Toilet training, 15% improved with rehab, whereas with cell therapy, 35%. Command following, 40% with rehab, 58% with cell therapy and rehab. Eye contact, 14% with rehab, 69% with cell therapy. Aggressiveness, 40% with rehab, and here 47%. And 24% with as compared to 70% for attention and concentration. So you can see there is a big difference between children who have taken only rehab and children who've taken rehab and cell therapy. And these are some various outcome measures. So we have published 5 papers on this. So a question which all parents will be asking is, how safe is this treatment? So here's the good news. We have had no major adverse events or complications, no neurological deterioration. However, there is one risk that we have to keep in mind, that 3% of our patients have an increase in the incidence of epilepsy. But these are primarily in patients who've already had epilepsy in the past or whose EEG is abnormal. Although it's a small percentage, 3%, but when it does happen, it can be very distressing for the parents. 10% of our children get a headache, and some will have some nausea, vomiting, local pain, etc. Now, we've published this in a scientific paper. You know, doctors normally publish only their good results, but we published a separate paper on seizures as an adverse event of cellular therapy, where we have documented and showed what percentage get these seizures. So all our work is done with permission and oversight of a health ministry CDSCO registered institutional ethics committee. What I would like to state is that cell therapy is not a cure by itself for autism or CP. You have to combine it with conventional and comprehensive rehab. And presently, it's not a standard of care, but is to be considered as a clinical option. Now, I'd just like to end quickly with some integrative therapies that we've introduced over the last 5-6 years. These include the following: hyperbaric ozone, gut cleansing, diet, acupressure, supplements, and vitamins. So what are the oxygen-based therapies? There is something called hyperbaric oxygen. This is when you give oxygen under pressure. So when you give oxygen under pressure, there's a chamber in which the parent and the child go. It's very comfortable. It's translucent, so you don't feel any difficulty or claustrophobia. There is a TV going on with cartoons which the kids love to watch. So it's a bit of a fun thing. But how does hyperbaric oxygen work? So normally in the above picture, that is a blood vessel. You can see that in our blood, there is a liquid, and then there are red cells and white cells. Normally, you and I, what we are breathing now, when we breathe, oxygen goes into our lungs. From the lungs, it goes into the bloodstream. And only the red blood cells in the blood carry the oxygen to the rest of the body. There is no oxygen in the liquid. There's no oxygen in the white blood cells or anywhere else. But when you give oxygen under pressure, now the oxygen goes into the liquid of the blood and the entire blood vessel is full of oxygen. So much more oxygen goes into every part of the body, and this helps in repair and healing. So it helps by improving the immunity, stimulating oxygen. It improves the metabolism, energy levels, and overall functioning. Then there's another therapy, ozone therapy. What is ozone? So oxygen, regular oxygen is O2, and ozone is superactivated oxygen or O3. Now, how does it work? Basically, it kills all the infections in the body, whether they are viruses, bacteria, or fungus. It reduces inflammation and swelling, blood clots, and act as an oxidant. So we have found combining ozone and hyperbaric is very, very beneficial to our children. Ozone can be given through the years. It is given, it can be given, made, the child can be made to breathe, or it can be given through this chamber. So then there is micronutrient supplementation. So there are all these supplements and all these vitamins, and we have found many of our children have deficiency of some of these. So this has to also be corrected. And these are the main things that we found need correction. One is methylfolate, which is a type of B complex vitamin. Then there is, vitamin D, which we are finding there are a lot of issues. Then we are finding, that magnesium and glutathione and NAC. These are various things that have to be supplemented when there is a problem, genetic problem. So I won't go into the details, but we are finding a lot of our patients actually have a genetic mutation by which B complex in the form in which it is given, particularly folic acid, the body can't absorb it. So we have to give it in different forms. Now, gut cleansing is very important. The gut of our children contains a lot of infections and a lot of toxins, and there is a direct access between the gut and the brain. So we clean it. We first do a gut microbiome test, which tells us exactly what the problems or issues are. We identify the nature of the infection and what are the deficiencies. Then we give specific treatment of the infections. Then we use pre and post probiotics. And we do gut cleansing using rectal ozone. And in older children, we can use colon hydrotherapy. So there are several ways to clean the gut. Other things that are useful we have found is acupressure or deep tissue mobilization, removing of heavy metals, various advice regarding diets. There are foods to eat and foods to avoid. In the foods to eat, pro and prebiotics are good, ketogenic, gluten-free, casein-free diet, all vitamin-rich food. But there's something very interesting, camel milk. There's a lot of science to show that camel milk is very, very beneficial for children on the spectrum, but this needs to be fresh camel milk. So in some parts of the Middle East, you can actually get fresh camel milk. And from whatever research I've seen, and when I've spoken to people who practice this, they say that it is very useful. We, however, have processed camel milk available with us. We are still using that, but the best is fresh camel milk. And there are some foods to avoid, like sugars, things with pesticides, additives, genetically modified foods, etc. Then there's ketogenic diet, which is high in fat, adequate protein, and low carbohydrates. So what's the scientific basis of our work? We've published a total of 106 scientific papers. What is the importance of this? See, the data I'm publishing, how do you know whether it's authentic? Because anybody can make up any data. But when we send our data to a medical journal, the editor, the editorial board, and 3 independent reviewers review the data, its authenticity, its scientific content, its ethics, and only then they publish it. So this is like a validation. So it's called peer review. That means somebody outside of you has reviewed your data and validated it. So all our work and all the results I've mentioned are from published scientific papers, both international and national. Like I told you, we've written chapters for different books, like this book on autism, this book on cerebral palsy, this book on physical disabilities. And we have published a total of 18 books. Initially, we used to write books for doctors. So our first books were stem cell therapy for neurological disorders, stem cell therapy for muscular dystrophy, etc. But then we found that doctors were not reading the books. Parents were reading books more than doctors. So then we started writing books for parents. So you'll notice in the second line, we have a parent guide for autism, a parent guide for CP, a parent guide for muscular dystrophy. Now, all these books are distributed free of cost. You can go to our website and you can download them free of cost. If you want hard copies, they're also delivered to you without any cost. We have so far treated more than 14,000 patients from 103 countries, from all the 6 continents of the planet. So people from all over the world have coming to us. So my conclusions are that newer imaging technologies are giving us better information about which parts of the brain are affected. Earlier, we didn't know. You have a child on the autism spectrum, you have a child with CP, and you don't even know what the problem in the brain is. But today, we are able, with modern imaging, we are able to, identify what is not working, but most importantly, also what is working more. Then multidisciplinary rehab and medical treatments are important. I've mentioned this here to emphasize the importance of rehabilitation. Without rehabilitation, there can be no improvement. What we suggest is to do rehabilitation on a repaired brain instead of doing rehabilitation on a damaged brain. So adult stem cell therapy that we use, which is autologous, can be considered safe and effective. Notice here again, I say safe before effective, because for us, safety is more important than efficacy. There should be no harm done to the child. So it's safe and effective treatment option for autism and cerebral palsy. So today we've discussed the following. We've looked at this comprehensively. You were told earlier nothing can be done for your child, and that is not true anymore. The first thing that we need to do is we need to image the brain and identify which parts of the brain are not working. We must do conventional rehab, but there are some special rehab that are also required. If the rehab doesn't help, then we must do cellular therapy. And when you combine cellular therapy with oxygen-based integrative therapies, you get much better results. So today we discussed all of this. These are all the topics that we discussed. Now I'd like to share a little bit about this. So what we have found is that the best results come when there is an absolute acceptance of the child the way the child is. Very often we don't accept our children. We love our children, but we not accept them the way they are. So absolute acceptance is important. You must understand what is happening to the child. We have found when the family works as a team, we get much better results. We have found families that structure the day, like everything is structured, fixed time for breakfast, fixed time to go to bed, fixed time for lunch. Their results seem to be better. Cell therapy helps, comprehensive rehab helps. We have to correct some micronutrient imbalances, and the oxygen-based integrative therapies, they also help. So soon we'll be coming up with a center in the Bahamas, I think in mid-25. We already have permission from the government and work is on way to have this happen. So I think middle of next year we will be there. The world's two biggest democracies are India and the United States. So let's look at the views of the Prime Minister of India and the President of the United States on stem cells. Before we do that, I'd just like to share that this is a book that I have written in which our Honorable Prime Minister, Sri Narendra Modi ji, has written an introduction. All right. So it's very, very rare that you have somebody of the eminence of Prime Minister Narendra Modi ji who writes an introduction for a medical book. But we are very fortunate that we have this. And this is myself presenting this book to Honorable Prime Minister Sri Narendra Modi ji. And here is a video of him talking in Parliament about stem cells.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहाँ गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
And now we will listen to what the Prime Minister of the ex-Prime Minister, previous Prime Minister of the United States, Barack Obama, had to say.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I'd like to thank you for your attention. I'm open to any questions that you may have. Ruchita, will you please compare this part?
Yeah, sure. Thank you. I believe, Mamta, if you're online, we have a parent who wants to share their story, right?
Yes, we'll connect her now.
That's good.
I think you just need to ask them to unmute themselves. I think Guru Param's mother.
Yes, I'm here. I'm trying to on my video, but it's showing like host has stopped it. So can you allow me?
Okay. Yeah. So
we can hear you, Param.
We can hear you, but we can't see you. So
okay, it's fine. It's
we
fine.
can hear you.
Okay.
Yeah, I think even in seeing you can. Yeah, we can hear you. Please, please do share your journey. I think parents will be, motivated by your journey.
Yeah, sure. Hi, everyone. My name is Param. My son is 4 years and 4 months now. The first time we came here, then he was 3 years and 11 months. We have done our stem cell in February, first week of February. And after 1 month, I have started seeing improvements. The drastic improvement I have seen, that is imitation. Before it was like whenever I am trying with my son to do some imitation, I am singing rhymes for my son and I'm trying to imitate actions, he was not showing any response. He was not showing any response and he was just giving me his hands to do it by like I will do it for him. So after the 1 month, I started seeing improvements. Like I was singing the rhyme and he started doing actions. And the one day we were like ready to sleep and we were just playing like together. And I said, Gurparam, say A, and he just like B. I was like very happy and I was like C, and he started D. Before he was a completely non-verbal, and one day he just started suddenly saying alphabets like A, B, C, D. Before he was very hyperactive child. He can't sit, he can't giving like 15-minute sittings. He just jumping here and there. But after 3 months, I have seen a lot of improvement. It's like now he's giving like 1.5 hour sitting, because we are giving like doing the therapies, and there are 2 therapies going together, 45 minutes and 45 minutes, and there is no gap in between. So he is giving now 1.5 hour sitting. Before it was not there for 10 minutes only. So his sitting tolerance improvement, his eye contact is improved. He started to mingle with other child or other kids. Whenever he's seeing the other kid, he just go there and touch his face and try to hug. If I am saying like, Gurparam, give kissy or give hug to your friend, and he's like showing that thing that he's trying. So I can see his eye contact is improved, his sitting tolerance is improved. And the best part is like my son was completely non-verbal. Completely non-verbal is like there is no words. Like it's been like 20 days. Now he's like drastically improved with the imitation in words. Now if I say mama, he's saying. If I'm saying say papa, he's saying. Even the big words, if I split that words and try to make him to say, and he is trying. Even he is like not able to say big words, but he's saying whatever, he's like making a sound or something. So from me, it's very drastic changes which I'm seeing. The one thing I also want to add is like his eye contact, and the other is like his understanding improved a lot. Now he start making choices. Even like just today he wants he wants a pickle in his while he's eating, he wants a pickle. And there were 2 like a boxes of pickle we have at home, and he chooses by himself. I was giving the other like the mango pickle, and he just like no. and he just showed with the finger like, I want that the other pickle. So now he's making choices. Before he was like, if I'm saying Gurparam, do and go hug to someone, and he just go and do hug. It's like following the instruction. Now if I'm the other person is coming and say, Gurparam, come and give me hug, no, he is making a choice. I don't want to give you hug. And he just like little understanding improved about strangers. Before it was not there. So there are a lot of improvements I am seeing, and I'm also going for the second stem cell, which is going in August. The thing is, like, I would like to say the parents is like, even Dr. Sharma also talked about it, like the acceptance. The first thing, if you accept the way your child is, then you can help it. It's like, if you are not able to accept that thing, if you are not clear in your mind what you are doing, what you want to do with your child, then you can't focus on your child, then you can't get that results. If you are very calm, relaxed, and you accept that thing, and you just make a plan, and just make a mind that you can reverse this thing with the stem cell, with the therapies and everything, then you can definitely do. Because I feel like that with the stem cell, the therapies or the integrative program is very important. I am staying here from last 5 months, and I have seen a lot of improvements in my son. So I definitely recommend it to all. If you guys can come and try this stem cell therapy, you must go on. Because this is the chance that you have, that you can do something with your for your child. If it is like, when I first time wanted to came here, I talked with many doctors or therapists, and everyone was like, no, there is something not like that, it's not happened like that. And we all my family members sat on a one table, and they were like, you are a mother, you know what's good for your child, whatever you want to do, we are with you. So my answer was like, if there is a no side effect, I will definitely go there. Because in my, it's like, my thought was like, after the 6 month, if someone like accidentally met me, and I was like, I have done the stem cell therapy, and my son or my child or my kid has improved a lot, then I will be dying a guilt that I wasted my a lot of time, like 6 months. So I also wanted to say this thing. Every child improvements or every child journey is different, every autism child is different, but you will get something after the stem cell. I can say you will get something, because I am getting, and I'm very happy. Thank you so much.
Thank you so much for that, Param. That was amazing. Thank you so much for sharing your heartfelt journey with us. I know this is going to inspire a lot of parents.
Yeah, sorry to interrupt you. I also want to share, my son started swimming also without any floater or without any help. Now I'm working on a cycling. Before it was like, the command following is also improved, that I missed to tell you. Now he can follow my commands, and he can speak like 3 sentence words also, like give me phone, give me something. So that's the other improvement I would like to add in.
Excellent. Thank you so much. Amazing. Mamta, do we have...
Why did you share your experiences? Why don't you share your experiences with Ira and Wade?
I will share, but I think Mamta has invited another parent as well.
Why don't we start with yours? He's just trying to log in.
Okay, so before I share, of course, I'd love to, I'm going to keep it very brief because I can see a lot of questions on the side as well. And I know people want their questions to be answered, but very similar to Gurparam's story, I have 2 children and both of them have taken stem cells. Both of them have taken stem cells with amazing results. Particularly my daughter, who had more additional needs. And she was a child who, at the age of 7, had severe speech disorder. She didn't know who she was. We used to put a wristband on her hand just in case if she got lost, so people would know exactly who she is, because she didn't know who she was. She didn't know where she lived. and she had no awareness at all. It was as soon as we took stem cell, the first thing I noticed is that her vocabulary increased, then her awareness increased, and very soon she was very, very, very sure of who she was. Now, as of today, you can have completely normal conversation with her. She's very alert, very wise, and she started taking a lot of responsibilities as well. She's 12 now. She goes to childcare and she takes care of little kids. She's very, very gentle with them. She's very empathetic. She also has some amazing craft and gifts that she's come up with, and all of that has actually come after stem cells. So I am extremely grateful to NeuroGen and Dr. Sharma for actually making this treatment available, because like most of you, I also thought that there was no hope. And I'm seeing something very different, and that's why actually I'm here, and that's why I'm so happy to host this session as well. So I'm here. You can ask me any questions anytime. At the end of the session, we will be sending you a thank you note with contact details to get in touch with me, and of course to get in touch with Dr. Sharma's team as well. But right now, we will go through a few questions. So I'll start. I know this question has been repeated a few
Ruchita,
times.
parent has joined, I think.
Okay.
Bhavesh,
Sure.
I can see Mr. Bhavesh Gorasia.
Yes, hi.
Please do share your journey.
Yeah, hi.
Arya's journey.
Yeah, hi. This is Bhavesh. I'm Arya's father. Arya has taken the first dose in December last year, and after the stem cell, 1 week, second week we were shifted to another center, which is like KLS, and she was not doing any toe walking before. She was started doing toe walking in 1 week. So it was like a negative behavior, but in a positive way. This means she started imitating. And we spoke to Nandini ma'am and Alok sir, and they said, this is a good thing. It's not a problem. And she was going in a special school. So sir has requested to, put in the normal school. And we are living in Dubai. So we tried to find a normal school, and luckily we got the admission. So now she's going in the normal school. And after the first dose, speech is still not there because the speech area is more damaged. As sir said, after second dose, the speech will improve more. But she has, very good sitting tolerance and very big improvement in sensory, because she has a big sensory issues as well. And she is taking instructions and following instructions. And the same feedback we are receiving from the school also. So yeah, she has started wearing socks by herself, t-shirt by herself, but she cannot put the buttons on because she has also a fine motor problem. But the fine motor has also increased, and a pencil grip is good now. And we just completed second dose, so we are looking a big improvement in next 1 year after the second dose. Yeah.
Excellent. That sounds like a very amazing journey, and I really wish you very well, and hope second stem cell gives you many, many more gains. So thank you so much for coming here and sharing your story with us.
Thank you. And thank you. I would like to thank you, Dr. Alok Sharma, sir, and the whole team. Because, when we came to NeuroGen, we feel like, family. Because everyone is taking care, everything. So, the amazing setup. Amazing setup. I have recommended many people already, but I like it.
Thank you, Bhavesh. And actually, this question is for Bhavesh and Gurparam's mom as well, and also for Dr. Alok Sharma and for Dr. Nandini, who are all on the call. There's a repeated question that keeps coming, like, are you seeing any regression? Are you seeing any side effects for your children? So parents who've done stem cell, like, are you seeing any side effects for your children? Because that's, obviously answered by parents, but of course, Dr. Sharma, please do answer as well. So Bhavesh, have you seen any side effects or regression for your child?
I also see many parents writing about this in there is one WhatsApp group, but for Arya, we do not see any side effect. Yeah, not
Okay,
at all.
thank you.
Not even during the treatment. I mean, about the nausea or seizure or anything. And also, there is no side effect we can see after the post treatment. After like 1 month, 2 months, 3 months, we have not seen anything. Luckily.
That's amazing. Thank you. I haven't actually seen any side effects myself. The only side effect I did see was a little bit of increase in hyperactivity in my daughter after the second stem cell, but that did go away after 3 months. And I know there is a question in the chat as well as to why the hyperactivity goes up. So that is something that I'm totally going to let Dr. Alok Sharma answer, please.
Yeah, Dr. Nandini, will you take that?
Yes. So good evening, all parents. So I am also seeing, of course, concerns about safety issues, and we completely understand that as and Dr. Sharma addressed that issue that there are no irreversible side effects. Now, when you are putting the cells in the brain, you're stimulating the brain, and we do want that the brain should get stimulated and should work more. That's the main focus of the treatment. So yes, sometimes the activity of the child increases, and parents worry about the increase in activity. But underlying, we have seen many parents who are positive, and underlying the hyperactivity see actually improvements in speech. So the children who are actually hyperactive also develop a lot of speech as well. So the hyperactivity is because the brain is getting stimulated. That's a part of the treatment. That is something that we do expect, and we see it not as a negative but as a positive indication that the cells are working. So hyperactivity, it is transient. So whatever effect or collateral effect that you see will always be transient. For example, there can be a headache after the treatment known as a spinal headache, which occurs between 2 to 3 days after the treatment, and this is a positional headache, and again is a transient thing. So any pain or the soreness which occurs will also be transient. So a few children, about 10% of the children, do have a little headache and pain, and there is a little discomfort which also could lead to a little increased hyperactivity immediately after the treatment. So most of the children have a little increase in restlessness and hyperactivity the next day after the treatment, but it settles down in 3 days. There is a small portion whose hyperactivity may remain from 15 days to a month, very rarely up till 3 months. So this is something which is part of the cells doing their work. So this is we assure from our side all the parents who come to us also that even if you see hyperactivity, don't worry, it will settle down, and underlying the hyperactivity, you will continue to see good improvements. Should I take the question about seizures also, sir? Hello.
Go ahead. Yeah, please answer.
Yeah.
I will
So
read
there is
out the question. I will read out the question just in case if others have not seen the question. So yes, there is a repeated question, not just in the chat also, but also when there were registrations done, there were a few parents who reached out. So there's the other big question that's been asked is, will my child get seizures if I do stem cell therapy, or will the seizures increase? So Dr. Nandini, I believe you are going to answer that question. So please do.
Yes. So now about the seizures. So one must understand what is a seizure. Seizure is basically a electrical activity of the brain going a little bit jerky or haywire. If you look at general literature done on children with neurodevelopmental disorders, research does tell us that in autism, there is a 20% chance, 20 to 25% chance of a child having a seizure anytime within 16 years of their life. This is irrespective of whether you take cell therapy or not. So in general, incidence of seizure is high in children with autism as compared to neurotypical or layperson, it is where it is 1 to 2%. In our experience, as Dr. Sharma did mention, and this is something which we have analyzed and published, those children who have a history of seizure or whose EEG is abnormal, any one EEG is abnormal, there is a 3 to 6% chance of having a seizure transiently after the treatment within 6 months of the treatment. Now, when we have this previous history, or if there is a history of EEG abnormal, then as a precautionary measure, we do put the children on anti-epileptic cover, which helps to reduce the possibility of seizure to less than 3%, or just about 2%. So that's if there is a history. Now, if there is no history of seizure, whether the child is 2-year-old, 3-year-old, or 10 or 12-year-old, what is the possibility of having a seizure immediately after the treatment or within 6 months? Our experience says it's very, very minuscule, but it is there because if there is an underlying seizure activity which has not been picked by EEG, there may still be a possibility of triggering a seizure, but the incidence is 0.2%. That converts to 2 out of 1,000. So out of 1,000 children that we treat, 2 may have a de novo or new seizure activity, which is seen. But again, this is transient and can be taken care of by medications. So as opposed to 25% in a child with autism in their lifetime, you can see with cell therapy the possibility in a new arising of seizure is just 0.2%. So we're looking at the effects or the positive benefits. I think 0.2% is something, statistically also it's worth taking that a risk. So that's the actual statistics that we have, and we keep analyzing and looking at how can we pick up the possibility of seizure ahead of the treatment and prevent it, because the main thing is if you know where the side effect is, you can take care of it. So that's why we are very vigilant about any sort of collateral effect or side effects. I think there was a question on behaviors also. Do you want to read that out, Ruchita?
I will actually I'll go right to the top. So the first question is, how many sessions of stem cell therapy is needed to assist a severely autistic child?
So yeah. So every child is different, and the way that we assess or we analyze from our experience what a child or how many treatments a child may require, there are a few parameters. One is a clinical assessment of the child based on how severe the child is. So even in severity, it's a spectrum. So the severity can be a moderate severity or it can be moderate to severe. So even in the moderate to severe, how severe the child is, what is the age of the child is very, very important. And depending on the age, where is the child social age? So suppose a child's chronological age is 12 or 13, and the social age as per a clinical assessment is 2 or 3, then we know there is a huge gap, and there the improvements will take time and you will need multiple treatments. The most important indicator for us is, of course, the imaging of the brain. The MRI shows the structure of the brain, and the PET scan shows the functioning of the brain. In the functioning of the brain, if we see that the affected area or the hypofunctioning area is more than 32 or 35-40%, then the child in an older age may require 3 to 4 treatments over a period of 1.5 years. So that's for a very severe child. So in a severe child, we expect the child to come to a moderate or mild to moderate in about 2 to 3 or 4 years. When you combine the cell therapy with good rehabilitation and oxygen-based therapies, we have found that oxygen-based therapies play a very critical role, especially in older children with severe condition, to get them to a good level of improved independence. That's what our aim would be.
Brilliant. Thank you for that. There is a question, since you've mentioned about age. The question is about, my son is 14 years old with autism. Some say hypoxia condition and nonverbal from USA. How long will the stay be in India? Because there are a few questions on the stay, like the questions are whether is everyone required to stay in India for 2 weeks, or how long should they be staying in India basically, and will it work for a child that is older? So there have been a few questions like that earlier.
Right. So for an older child, as per the data presented also and our analysis and our published results, we find that children a bit less than 5 years, of course, have the best results. Those who are 14 and in puberty, yes, can be treated. There is no child who cannot be treated. It's just that the time required for the child's improvement is slightly longer. It just takes more, persistent efforts in these children. more so because they are older, the brain is more rigid, and hormonal changes have made the brain more rigid and less plastic, but doesn't mean it's not possible to improve. It is possible. We have seen very, very severe 14, 15-year-old non-verbal children also improve and become verbal. So of course there is a possibility. The 2 weeks treatment basically has the oxygen-based therapy in it, and especially for older children, we do believe that oxygen-based therapy is very, very important unless it is contraindicated. So hyperbaric oxygen therapy is contraindicated when there is a ear infection or there is uncontrolled seizures. Otherwise, we would recommend a 2-week treatment to all those who can take it. It does significantly improve the possibility of the child, response to treatment becoming better, faster, the brain scan, the brain functioning improving faster, children who are non-verbal becoming verbal faster. So the 2-week is a highly recommended treatment, but those who have a history of seizure and those who have repeated seizures or ear infection, then we cannot recommend the hyperbaric oxygen therapy. Then a 1-week treatment would be recommended. So the treatment is either 1 week or 2 week, and each child would be evaluated based on the child's condition, and a recommendation would be given by our junior doctors. So yes, a 14-year-old child can be treated. How many treatments they will require? Again, as I said, we will do a clinical assessment and the PET scan, and thereby after that we will be able to give you a knowledgeable opinion as to how many treatments potentially the child will require. But yes, 2 weeks is a recommended treatment option.
Thank you for that, Dr. Nandini. So there is another question, and I think about the contraindications, I think we've already covered. Also, are there any regressions? So that's been covered. The third question by the same parent is, I read that stem cells are grown in a lab for 2 weeks before being introduced in CSF. If that's the case, am I to stay for more than 2 weeks in India?
Mr. Joshua, so I see your question. No, the treatment that we do, Dr. Sharma explained very beautifully that what and within a few hours the cells are separated. These cells contain a mixture into the CSF the same day. The CSF itself is a very good culture medium. The CSF is our body's laboratory. So we actually do not need to cultivate the cells outside. The cells will multiply in the CSF itself and will give us a multiplication similar or better than what we can culture outside without any interference from any contaminants. So no, you do not need to stay more than, you are welcome to stay more than 2 weeks, but for the cell therapy procedure itself is just 1 day, followed by rehabilitation and oxygen-based therapy for which you need 10 more days. So the total treatment is 2 weeks. First 2 days is for blood workup and brain scans and initial assessment. So we take a lot of time to understand the child's condition first. Then 1 day, the third day is actually the procedure day, both the aspiration and injection of the cells on the same day, followed by rehabilitation, monitoring for any immediate side effects like pain and soreness and headaches, and oxygen-based therapies. So 2 weeks is good enough, but you want to stay longer for rehabilitation, you are most welcome.
Again, thank you so much for that answer. I'm going to move on to the next one. I have a 4.5-year-old autistic daughter, and she's on level 3 and nonverbal and has high sensory issues. Please tell me more about the procedure. Is it invasive?
I think the procedure has been explained. So maybe this question came at the beginning, or is it somewhere in between?
It's a bit later. Person joined later. I think probably the question is it an invasive procedure?
Okay.
From so a perspective.
Yeah. So you have heard a parent of another 4-year-old child speak to you. That child is also from Australia. So Guru Param's mother spoke. So we have treated the youngest child that we have treated is the 8-month-old child with cerebral palsy, and 14 months old child. So even in younger children, because this treatment is minimally invasive, there is no cut, there is no stitch, there is just one needle in the hip bone, one needle in the back. Children are able to tolerate it, and with, of course, proper cover with painkiller. and under sedation and anesthesia. So yes, your four-year-old child will be able to tolerate it very well, and very strongly recommended because she is young. So, this is a great age to start the treatment. We would recommend that, do not lose this window period. We have seen amazing results with younger children, and especially girls. We are somehow seeing amazing results with girls. Of course, we are still to put together the data, but more often we are seeing children, the girls becoming neurotypical faster of late. So please do bring your 4-year-old child. The sensory issues will slowly go down. Her understanding and comprehension will improve. Her social awareness will improve. Speech may take a little more time, but she will settle down faster, and you will be able to do good rehab with her. Because right now, I think the limitation is that she doesn't respond to rehabilitation, if I'm not wrong. So do the cell therapy, and followed by that, when you do the rehab, you will see beautiful improvement. So yes, please do. Very, very strongly recommended for a 4-year-old child. We believe, when we see a younger child, we really want that, the parent should take advantage of this treatment rather than wait to see what happens in due course of time. I think Guru Param's mother will, corroborate this too.
Absolutely. And thank you so much for that, Dr. Nandini. The next question is from Chris. And a lot of the questions that Chris has asked has been answered. So I'm going to read the questions anyway, but they have been answered. What's a reasonable timeline for such a treatment? So that was answered. How many sessions are necessary, which you answered already. What are the costs of the treatment? So the cost is something that obviously they can contact NeuroGen and ask for later. What is the methodology? I think Dr. Alok answered that through his presentation. And where to get started? I think that's a very legit question, and many parents do call me and ask me as well. So where do you get started?
So the first would be to reach out to us. Now that you are part of this webinar, you will be contacted by our team, and we would recommend you to, if you're interested, share the child's details. One of our colleagues, junior doctor, will connect with you, understand your medical questions if there are any. If there are no medical queries and everything has been answered here, then Mamta would coordinate further and be in touch with you to help you with the logistics. So one is the medical part. Once your medical part questions are answered, then we go into the logistics. The logistics would be the cost and how to travel, how to get the medical visa. All that will be coordinated by Mamta, who's here on the call too. So she will be your point of contact, and she will coordinate for the logistic details. So each one of you will get an email, as Ruchita said, and someone will get in touch with you personally as well.
Brilliant. Thank you so much for that. So the next question is around, we are worried around the side effects as the child is very, very sensitive to medications, including vitamin tablets. And right now, the behavioral issues, right now there are no behavioral issues. The child is very loving. So they are worried, will stem cells actually aggravate anything negatively?
Yes, Siri, we understand your worries, and when you come here, you will see there are so many parents, and you will feel, much assured. So yes, these effects, if at all, like the nausea and the headache, are temporary, and they get taken care of by medications and proper hydration. That's why a minimum of 1 week, so that after the treatment, if in 3 to 4 days, whatever the child has any concerns can be taken care of in the hospital. The vitamins, yes, most children with autism are very sensitive to vitamins. The vitamins have to be started at very, very low doses. So our aim is always to minimize the medications that are given, but there are certain medications which need to be administered for the procedures. For example, the sedation and anesthesia, 2 days of antibiotic, painkillers, and anti-nausea medication. So these are minimal things. The vitamins are all based on the levels of vitamin in the blood. For example, if vitamin D is low, then we would recommend vitamin D. Vitamin, if the folic acid and homocysteine levels are imbalanced, or a vitamin, so then only we will give vitamins. So we do not give a lot of vitamins randomly unless there is actual need or justification for it. So the medications are very, very minimal. and these are the most minimal that you can do for any procedure. So, and most of the things, your concerns will be taken care of. The treatment is simple, it is minimally invasive, it is well systemized treatment, and whatever the child undergoes any trouble, these are transient effects and taken care of whilst the child is in the hospital. So we will be there to handhold you through all your concerns and worries. So
excellent. Thank you so much for that, Dr. Nandini. The next question is around, can you share any scientific?
Again, sometimes it happens because of the injection that is given into the spinal fluid. It is when the child sits up, has a headache, when he lies down, feels better, and the headache is sometimes accompanied by nausea. But not everyone. 10% of the children have this, so 90% do not have. So let's hope and pray that your child comes in the 90%. For example, Guru Puram and Arya, they said the next day they started running and jumping around. So most children, in fact, they are active the same day. So,
and Dr. Nandini, if a child does get, spinal headache, does it go away very quickly? Like, because that is another question that parents often call me and ask as well.
Yes. So minimum of 2 days, maximum of 3 to 4 days. That's it. So and the child will be hydrated. Intravenous fluids will be given to ensure that the headache goes away quickly. You have to just hydrate the child. That's most important for a spinal headache. So never more than 3 to 4 days.
And another question that has always been asked is also around whether the needle where, on the spine, where the needle goes in, does that pain remain? So there are a lot of parents who have been asking that question.
The needle is very, very thin and it goes between the two bones. The pain, if at all, or soreness will be there for 2 to 3 days maximum. After that, the child doesn't have any pain later. No. So all these are very, very temporary pain or soreness, and I can assure you that these do not have any long-term implication. No weakness in the back, no long-term backache. No.
There is a question around, can you please share a scientific research article and studies on stem cells? So if it's okay, in our thank you note, when we send that, is it okay to send some links to articles for everybody?
Absolutely.
Lovely.
So Mamta, you
Thank
can.
you.
Yeah, we'll ensure that everybody gets the publications, especially on autism that we have. We will send them the PDFs of the scientific
about
articles.
the needle pain. I can speak for 1 minute if you want.
Yes, please, Bhavish.
Yeah, after the first dose of Arya, she was like, she was already awake when she came out of operation. So it's like, very, very small anesthesia that they give. And immediately we go to the room, and then Arya was playing, and then I bring her down in the ground floor also. So, for her, the pain was very, very minimal. And both the dose, 15 minutes, she was like, okay. The second dose,
actually,
it was a little bit more. But the first dose, it was, nothing.
Most children are very resilient. We understand parents worry, but, unless the weight is very less and, they're very delicate, generally children are, in fact, they have more energy and more, I would say, strength than us also sometimes. So, yes, thank you for that info, Bhavish. I appreciate it.
Yes, absolutely. Thank you for that. There is one more question, and there are a few questions from previously sent by parents as well. So another question is, with non-verbal and non-communicative children, how can we assess that there is spinal headache?
Yes. So most of the children that come to us are in fact non-verbal, and even if they are verbal, they are not able to indicate pain. The way we understand that the child has pain is that, number one, if there is a spinal headache, the child will not want to sit and walk. So the moment we understand the child, one doesn't want to feed orally and doesn't want to sit, by default, we think about a spinal headache. That's why on the day of the procedure is Tuesday, we keep the IV line intact till Wednesday at least, till we are sure the child is up and about and eating and feeding and drinking. So we do not remove the intravenous access for the fluids unless we are very, very sure the child is, completely all right. So if the child doesn't want to sit, doesn't want to walk, which is very, very, unlikely in a child with autism, that means the child has a pain. So then again, the fluids, the painkillers will continue for such a child. So we can understand a child who is distressed because of this experience of the last so many years. So that's why the child is in the hospital for at least 4 days after the treatment.
Excellent. So there was another question, and the question was actually around, I'm just reading Williams syndrome case X. So will the stem cell help Williams syndrome case X?
Yeah. So Williams syndrome is a genetic condition, and generally these children are actually quite friendly, very, very socially interactive, but they do have certain conditions, and it varies again from child to child. Comprehension, understanding is not as age appropriate, fine motor activity, sometimes speech and articulation, and they are syndromes. So these are syndromes. So the other parts of the syndrome which are not related to the brain need to be taken care of medically, or if there any surgical issue. But the cognition and the comprehension can certainly be improved. And we have treated a couple of Williams syndrome cases because these are very rare conditions, but we have seen good improvement in Williams syndrome.
Okay, that is excellent. There is a question from a parent, and they are asking, what is a realistic expectation after stem cell?
Realistic expectations would depend on the age of the child and the severity. I would say general improvement in comprehension and understanding, social awareness. These are something which you can definitely expect. A child who is younger and nonverbal does become more quickly verbal than an older child. So everything will depend on the age of the child, the severity, and the brain scan. So, but by and large, comprehension, understanding, social awareness, a better ability to learn things, grasping what you may have been teaching for years together. After the treatment, the child learns quickly. So the child becomes more capable of learning and taking information from the surrounding. So you will see that your efforts which you were doing before the cell therapy become more effective after the cell therapy, because the brain is now more compliant, is like a sponge, and will seek all the information and stimulation that you give, will pick it up faster.
Absolutely. And there are a few other questions coming in. So the next one is, under what health conditions will therapy be cancelled, like fever or some temporary issues?
Yes.
My son falls sick whenever he travels to India.
Yes. Completely, can understand what you are thinking, Leena. Leena asked it, right? Who asked? No.
That question was from Anirban.
So yes, most children, especially those who are not very exposed to the Indian climate, do fall sick. If the child falls sick, then we wait for the child to become all right. And that's a principle that we do not budge from, even at the cost of the parents' inconvenience. So if the child has fever, then we wait for the fever to become all right, and then we treat the child maybe the next week. So if there is any fever is one of the most common things that we do see. So yes, and if there is any other contraindication, like we do blood workup, and if we see liver function or something deranged, or platelets very low, hemoglobin very low, first we correct that. And if it is correctable within a week or two, we correct it and do the treatment. If it is something which is very low, very rarely it happens that the hemoglobin is very, very low, then we have to wait for it to become okay, and then we do the treatment. So the keep the child's hemoglobin at least 10 gram and above is our request and recommendation. So if the child is not fit for the treatment, we wait for the fitness first.
Excellent. Thank you for that answer, Dr. Nandini. There is a question in the other list, and that is around ADHD. And parents have asked whether ADHD can be fully reversed through stem cell therapy.
There's only ADHD or autism with ADHD?
Only ADHD.
Okay, yes. So ADHD has the primary treatment is of course medications. Now the level of ADHD also varies widely. If ADHD is taken care of properly early on, then intellectual issues may not actually be seen. Mainly the problem is focus. But if ADHD is combined with a delayed development in terms of understanding and comprehension, both ADHD and improvement in intellectual functioning is possible. So yes, because again, ADHD is also, I would say, a milder version of autism. If you look at the brain functioning, similar areas are affected, but to a degree lesser than what you would see in autism. So ADHD can also be treated.
And is there a chance of being reversed? Is yes the question. And
yes, again, so it will depend on what is the level of ADHD. It is possible. It is possible for ADHD to be corrected and the child's comprehension and learning abilities to be improved. But with a little assistance, if the child is on medications, we generally do not recommend to stop immediately, at least for the next 6 months. And once the child settles down, and then slowly the medications can be weaned off. So yes, the child's ADHD can be reversed.
Excellent. There is a question around HBOT and ozone therapy, and the question is it absolutely necessary to have those treatments post stem cell therapy?
These are strongly recommended. There is nothing mandatory. It is just our experience shows. See, the first 10 or 11 years that we were doing cell therapy, our cell therapy was combined only with neurorehabilitation. But we keep on constantly looking at what more can be done and what can be done better to improve the efficacy of the treatment. There were certain areas we found that were becoming all right. It took a lot of time, like speech. The child becoming verbal. That was one thing we were finding. There was a lot of challenge. And where we look at what else can work in tandem or in collaboration with the cell therapy, and we studied hyperbaric oxygen and ozone therapy, which both improve oxygenation in the body and in the brain. So we found that they actually stimulate the cells and they were complementary with the stem cells, and the complementary result as analyzed by our research team gives at least 10 to 15% more improvement within the same time frame or lesser time frame than when you would do only cell therapy. So it is recommended very highly, but finally it's up to the feasibility of the parents and whether they can come and stay for at least 2 weeks. But most parents that we have seen is that initially they come for a week and then they make a decision after seeing other parents that, oh, they should have stayed for 2 weeks. So yes, I mean, it is not mandatory, but it is highly recommended.
Excellent, thank you. So there are 2 more questions. So one question is in the group, and that is, my son is 3 years and 10 months and got his first shot in March and pretty happy with everything and how it's going. Just sensory issues have arrived. Will new things come up?
Yes, yeah, Ramneet. So good to hear that the child is doing better. Now, sensory issues are part of, I would say, every child's life, and sometimes more in an autism. Some sensory issue will go, something else will come. You need to look at a few things. First, most common cause of sensory issue is gut issues. See whether your child is eating well, is pooping well, whether he has any constipation and sleeping well. If there is any disturbance in any of these, then you need to first correct that and the sensory issues will reduce. So if you can get in touch with us and let us know, we will guide you. There could be some trigger factors which have stimulated those sensory issues. So yes, as a child grows, there will be some things which will come, some will go, but everything has a root cause, and that root cause needs to be addressed.
Thank you, Dr. Nandini. There is a question around PET scan, and is the PET scan absolutely necessary?
Yes, the PET scan is absolutely necessary because that is the basis of the treatment that we do. If the PET scan is absolutely normal, that means the brain is fine and cell therapy is not required. Also, it gives us a guidance as to what is the severity of the child. What are we looking at really? When you ask us how many treatments to be done, then the PET scan gives us the answer. So yes, a baseline is very important to start any treatment. That's why we are different, right? Because we understand. We first understand clinically and through imaging where is the child now, and what all do we need to do to improve the child's condition. So the PET scan, definitely for the baseline, the first PET scan is most important, and this is definitely mandatory.
Thank you. There's a question around genetic disorders. So can genetic disorders be treated by stem cell therapy?
Yes, genetic disorders can be treated. As we spoke about Williams syndrome, Williams syndrome is a genetic condition. Now we have to understand that the genetic condition, the gene defect per se cannot be treated, but the effect of the genetic defect on the brain can be treated. Finally, whatever be the genetic problem, if the brain is affected and that leads to intellectual disability or leads to autism-like features or leads to even physical issues, the brain functioning can be improved using cell therapy. So we are not correcting the genetic defect, but we're improving the brain functioning, the working of the brain, activity of the brain can be improved, which can help improve the functioning and quality of life of the child. Now, the follow-up question in this generally, which I do get very, very frequently, all of us get, is that in a genetic child with genetic condition, how do we use the child's own bone marrow? So the bone marrow, when we use the bone marrow is healthy unless the child has blood disorder like a sickle cell anemia or a leukemia or a thalassemia, then we cannot use the bone marrow. But the bone marrow per se, if a genetic disorder is affecting the brain, the bone marrow is not affected. So we're using the blood forming stem cells to improve the brain functioning. So the raw material is absolutely fine. What we are doing is improving the brain functioning. Now, the genetic condition which has caused this problem has already caused it. It doesn't continue to affect the brain functioning because whatever damage it had to do, it has already done. Now what we are doing to do is repair the damage. So yes, genetic conditions can be also treated. Not the gene part cannot be treated, but the brain functioning defect can be improved.
Excellent. There is another question from the other list, and that is around diet. So do children need to have a specific diet after stem cell therapy?
Now, the diet after stem cell is specifically not for the stem cells, but more for the autism. So in general, for all children, and especially for autism, we suggest that you avoid processed food. You definitely try and avoid refined sugar as much as possible. If possible, do a GFCF diet because all these does help the gut to recover and reduces the inflammation in the gut. And gut problem is inclusive part of a child with autism and other neurodevelopmental condition as well. So the diet would be more for the autism and the inflammation in the gut rather than for the stem cells. So we would recommend, but suggestion always is do things stepwise. Don't do anything which will completely make your child stop eating. So compliance is also important. We expect after the cell therapy, the child will start becoming more open to eating different kinds of things. That's one thing that we typically see in most children. The pickiness reduces. Child is more open to trying different textures and eating better. So then you can actually change the child's diet better and thereby reduce the inflammation in the gut, which will eventually help reduce the inflammation in the brain as well. So again, not directly for the stem cells, but for the autism, yes.
Thank you. Dr. Nandini, I'm very conscious of the time. There are 2 more questions to go, and then obviously we can shut the meeting down. So I hope that is okay with everybody, including you, Dr. Nandini and Dr. Sharma. So the next question is around, someone's asked around Ayurvedic interventions. So they've said after how long do they have to wait for Ayurvedic interventions after stem cell therapy and any other interventions for that matter?
So before you come, at least for a couple of weeks, stop any treatments except anti-epileptics if you're already taking, thyroid medicine if you're already taking. These are essentials. Ayurvedic and homeopathy, it's not that they don't work or it's not that we have any problem with them. We just don't know how it goes before and after the treatment. Maybe a couple of, at least 2 to 3 months, we should wait. Unless this is something the child has really benefited from. So we look at whether the child has benefited from Ayurvedic treatment or homeopathy treatment. And then we look at the content of what is there. If there are no heavy metals in the Ayurvedic treatment, it is only herbal, then maybe after a couple of months you can restart. But we will give that advice on an individual basis whenever the child comes to us. Multivitamins, again, as one of the parents said, their child is very sensitive to vitamins, and similarly, most children are. So multivitamins also, we will give you a stepwise way of restarting those vitamins after a month or so. So generally give a gap of 4 weeks to 8 weeks is the general principle.
Excellent. I'm going to ask you the last question. And the last question is, actually, there are two questions. Sorry, one just popped up. We will stop questions after that only because we are conscious of time. So the first question is, what is the gap between the first and the second treatment or between treatments?
Yeah, a minimum of 6 months is recommended. It takes 3 to 6 months to see the changes in the brain as they improve and the improvement in the child. So we would like to wait for 6 months before considering the next treatment. So anywhere between 6 to 9 months is the recommended time period of the gap between first and second treatment. After the second treatment, again, depending on the age, if the child is older, like a 10-year-old or 12-year-old, then we are in a bit of a hurry. So we say 6 months again. For a younger child, we can wait for 9 months, definitely.
Excellent. And the last question, lucky last. Some stem cell institute uses umbilical cord blood for their treatment. What's the difference?
Yeah, the difference is like, Sir gives this example all the time, whether you prefer a homemade orange juice or whether you prefer a packaged Tropicana. So cord blood is like a packaged Tropicana where it is stored in preservative known as dimethyl sulfoxide. So dimethyl sulfoxide is a cryopreservant which keeps this cell alive at minus 190 degrees centigrade. So just imagine yourself being in a very, very cold environment. What will happen? Your body will die, the cells will die. So to keep them alive, there is DMSO, and this DMSO is very, very toxic at room temperature. So when the cells have to be injected in a normal body temperature, this DMSO has to be completely washed off, because even if 1 or 2 drops remain, they can cause very life-threatening complications like anaphylactic shock and shutdown of the body organs. And especially for the brain, it becomes, because brain is very, very delicate, it's really not recommended that these cells should be injected into the spinal fluid. We believe that the brain functioning has to improve. That is our target. So we believe in injecting the cells into the spinal fluid. So cord blood cells, from our experience, are all right to be given in the veins, like a drip, but not recommended to be given near the brain. So that is one of the main, this is reason number 2. So reason number 1 is a cryopreservative. Reason number 2 is that cannot be given intrathecally. Number 3, when you are given intravenously, again, the cells will go all around through the blood, through the heart, to the lungs, to the liver, get filtered, and finally what reaches the brain is very, very minimal. So how many cells finally reach the brain using an intravenous cord blood transfusion is anyone's guess. So these are the various differences. So the cord blood will give more systemic effect. It may help your lungs become better, your heart become better, any injury in the body become better. But whether it will really repair the brain, there is no evidence to say so. So we believe taking cells fresh from the child's own body, separating it, and without any chemical mixture and injecting into the spinal fluid. So this is a short answer, but for this, I think Dr. Sharma has, I'm sure, explained the types of cells during his presentations. So please do. I think we will be sending you the presentation.
Excellent.
You can have a look at them as well.
Thank you for that, Dr. Nandini. So I'm actually going to hand over back to Dr. Sharma, who's going to wrap up the presentation. But before that, I just want to remind all of you, this is not the end of the road. This is actually just the beginning for all of you. And I know you must be, a lot of your parents must be doing research. So please do take the opportunity to connect with NeuroGen. And, when we send you a thank you note at the end, we will also be requesting you for some feedback. Because your feedback then helps us to understand what sort of sessions we should be booking in the future, what sort of the sessions we should be designing in the future. So please do take 2 minutes to give us feedback on how the session went. There will be a lot of information along with how to get in touch with NeuroGen, how to also get in touch with Inclusive Horizons. So that will also come to you through the email. So please do watch out for the email. And thank you so much for your presence here today. And I'm going to hand over to Dr. Sharma to finish off the session.
So much, Ruchita. You one for, of course, arranging this, and you conducted the whole session very beautifully. Thank you for being an amazing anchor. So to all the parents who are here, we are all here for just one reason, that our children have special needs. You've done everything possible for your children. You've been to pediatric neurologists, you've been to therapists, you've done therapy, you've tried diets, you've Googled, you've tried other things, maybe homeopathy, Ayurveda, and at the end of it all, our children are still limited in function, although they've had improvements, but the improvements have not been significant enough to get them to lead close to normal lives. The reason being that there is a part, if you remember my presentation, I showed you the part of the brain, in particular the smaller brain at the back and the brain on the what is called the medial side, that was not functioning normally. And up to now, there was no treatment for it, but we have shown with our autologous cell therapy procedures that this damage can be repaired. We have shown that it is safe, that risk of epilepsy that we spoke about is small and manageable and not irreversible. So apart from that, there's no major risk. No child of ours has deteriorated or become worse than before. In fact, once the children improve, they don't just get to be normal, you start seeing exceptional qualities in them. I can recall Ruchita's son Ved, and I remember, treating him, and today he is doing astrophysics and aeronautical engineering. Am I correct, Ruchita? You're mute. You have to unmute yourself.
I'm on mute. Aerospace engineering. He's doing space engineering.
There's a child who took, who had a lot of difficulties in reading, writing, and today he's doing aerospace engineering and astrophysics. I mean, like what? That's amazing. And so that is the possibility with cell therapy, because it repairs the fundamental damage in the brain. But after that, there is a lot of work to be done by parents. So if I compare the brain to a computer, like I did in my presentation, there is the hardware, there is the software. We fix the defective hardware. So far, you are doing all the therapies. In other words, you're trying to put software on defective hardware. Once we fix the defective hardware, now your therapies and everything you teach the child at home and through therapies will have a better result, a better output, and you will see improvements in your child that you've never seen before. So we basically have two options now. Option one is to continue life the way it is, in which case our child will be the way he is, he or she is. There will be some natural improvements that will happen with age, but the basic defect in that brain, that blue that we showed you on the scan, that won't go away. Right. So a child will always have a limited and will need a protected life, will need to be looked after specially. The other option is to opt for this treatment, which is safe. There is no side effects, there is no regression, no child deteriorates or becomes worse than before. So safety is like, definitely there. And there are improvements, but the improvements come slowly. You start seeing them at 3 months and they go on for 2 to 3 years. So we have to choose between one of these two options. Now, what is the problem with not doing anything and waiting and watching? Like we said, the earlier we do the treatment, the better results we get. So if you do the treatment when your child is 6, you're going to get much better improvements than when your child is 8. And if you do it when your child is 8, the improvements are much better than if your child is 11. So the earlier we do it, the better it is. So my suggestion is as follows. Those of you whose children have milder issues or problems, and they are improving naturally with rehabilitation, and if they're improving and you feel that the improvement path is such that they will be able to lead independent lives, then we should continue with rehab. But if you're doing all the rehab and despite that you feel that the child is not improving as much as you would like, there are still limitations and restrictions, then I would suggest that we do this treatment because this will help repair, the brain damage and give our children an opportunity not just to have normal lives. The aim of all parents when you ask them is we want our child to have a normal life. What we are finding is like Ruchita's son Ved, who is now doing aerospace engineering and astrophysics, these children excel. They do extraordinary things. They do things that we can't even imagine. So there's a lot of science to show that this works. Yes, unfortunately, this is presently not available in many of your countries. So at present, you have to come to India. We are looking at options of doing, having centers elsewhere. But at present, you're most welcome to come to India. We are there with you. I want to thank both the parents who spoke. I want to thank all of you for attending. I want to thank Dr. Nandini for answering all the questions beautifully. By the way, Dr. Nandini does an Instagram live every Wednesday at what time do you do it, Dr. Nandini? At 5 p.m. India time, IST. So I think Dr. Nandini are there. Okay. So Dr. Nandini does this Instagram live, and there you can ask many more questions. If any of you want, you can set up a virtual consultation with either myself or Dr. Nandini. You have to coordinate with Mamta, Mamta is a number on the screen. If it's there, Mamta will put up a number on the screen. You can set up, there will be a 1 or 2 week waiting list, and we can set up a virtual consultation, which is free of cost. We don't charge for it. So if you want to do a one-on-one directly with myself, either myself or with Dr. Nandini, it's available. Let's see, Ruchita, who's arranged this, and we can do it. Otherwise, by the way, there is almost a 3-month waiting list for that consultation. But now, those of you who are part of this, we will do this in the next week. So please reach out to Mamta, and then we could, sort of have a consultation, take this forward. So once again, thank you, Ruchita. Thank you to our parents who spoke. Thank you to all the parents who are on the panel. Thank you, Dr. Nandini, and thank you, Mamta, for coordinating. Mamta has been a great help. She's the one behind all of this, and she set up everything at the back end. So thank you, Mamta. Over to you, Ruchita.
That's it. I think that's going to be a goodbye from our side as well. So thank you so much. To everybody, to Dr. Sharma, to Dr. Nandini, to Mamta, of course, and to Gurparam and also Bhavesh. They all collectively, it's been an amazing session. I know it's gone a little over time. If you want me to actually conduct more sessions, please do reach out to me as well. I think most of you know how to reach out to me through our WhatsApp group. I'm available to all of you. So thank you. Have a wonderful day ahead and good luck with your research and decision making.